And as you probably know, we talk a lot about Medicare for All on this show. And one of the leaders, certainly as an organization, perhaps the leader in the fight for Medicare for All, is National Nurses United, NNU. They've been fighting on this issue and for this issue for a long time. And joining us now is Jean Ross. Jean is an acute care nurse herself with many years of experience. She is also co-president of National Nurses United, and she's here to tell us basically what's going on with NNU's Medicare for All efforts, where we are and where she sees us going. So without any further ado, Jean Ross, thanks for coming on the program.
I'm very happy to be here.
Well, we are glad to have you. And I guess I would start by asking, okay, we just got through an election. Everybody was focused on it. I would say far and away a record number of candidates ran on Medicare for All as an issue. Certainly 2-4 years ago, you would have never seen something like that. Things have certainly shifted, don't you think?
Oh, absolutely. We ourselves, our union has been dedicated to this cause for literally decades. And now that we do have those people in that are willing to sponsor and support the House bill, H.R. 676, that would be the Expanded and Improved Medicare for All Act, we know that it's going to take a tremendous amount of organizing, even more than we've already done. And we are ramping up to do that using, at the grassroots level in states across the U.S.
Well, and let's talk about, first of all, let's talk about what it is, because I always like to emphasize this point. We're seeing now from Donald Trump and others the kind of scare tactic directed at seniors that, this effort for Medicare for All is going to, it could endanger your Medicare or whatever, which isn't true. So I just want to emphasize that we're really talking about Medicare for All and expanded Medicare for the people who have it now. What we're really talking about is something that's even more coverage than Medicare today offers, right?
Yes, absolutely, because over time, they've tried to do little privatizing efforts on Medicare too, and cost sharing, copay, that kind of thing. And so we want it back for the reason for which it was intended, albeit even though it started at 65. And so the kinds of things that Medicare doesn't cover now, for example, dental and vision, that kind of thing, that should be included. The reason we came up with and used Medicare for All is because we know how everybody in this country feels about Medicare, even if they're too young to use it. They've seen it for their friends or their parents. And once you're on it, you do love it because there's no more of this. Everything, you don't have to have money there at the point of care like you do for other private insurance companies. And so if we just lower it, in other words, you're born, you're on Medicare, people can get behind that, and people like that kind of a concept.
And it's not exactly a crazy idea, since basically every other developed country has some form of the same deal. So it makes perfect sense. There's no reason why in such a prosperous country with so much wealth around, people should have to face financial ruin, because even with insurance, if they get sick, no reason why they should go without the care they need for financial reasons. So it all makes a great deal of sense. American people seem to think so. More than 70% of them, last I looked, support the idea of Medicare for All. So with this kind of growing support for it, why are you guys feeling you have to ramp up even more organizationally, and how do you see that working?
Well, this is kind of our moment. We sense the grassroots level changing. Oh, honestly, back before when Bernie was running in the primary. And thank goodness that he put this in the forefront. Again, saying, just as you did, this is not a radical idea. And we have an opportunity now with the extra Democrats that we've got in the House, and also with the new House Medicare for All caucus. We have this opportunity now to work with them while continuing to escalate the movement building to get HR 676 passed. So to that end, we are talking to the people who co-sponsored, and there are a lot more of them. And of course, I think it's 123. And then the Senate won 1804. I think there's 17 co-sponsors. But we're letting them know and keeping the pressure on from the grassroots that even though you said, okay, you co-sponsored and you support, we're going to show you what support means. And support means you pass it, you vote for it, you get it the way we want it.
Well, and this is, I think this is such important work. Again, we're talking with Jean Ross, co-president of National Nurses United and acute care nurse. Jean, I think this is so important because I'm here in Washington, D.C. I'm working on a book about co-authoring on the road to Medicare for all, and I see a lot of what I call off-ramp plans on the road to Medicare for all. You know, I see a lot of people come up and saying, well, this is Medicare for almost all, or this is Medicare for everyone we can think of, or whatever. You know, there are these different think tank plans coming out, but they're not Medicare for all. They're going back to other sort of plans that would leave too many people at financial risk or what have you. And so while I worry like everyone about, you know, Donald Trump trying to fearmonger this, you know, scare everybody, I also worry about these off-ramp plans. And I'm wondering if that isn't part of your thinking in organizing, making sure that the elected officials stay on the right road.
Yeah, those types that you're talking about, most of us call the Medicare for All imposter plan. And what they'll do, like the public option, for example, there may, in the distant past, have been an opportunity for something like that, but now it would just kill any plan that you have that's truly a universal Medicare for all plan. So no, any of our people that we consider supporters, we will make sure they continue to understand that this is the kind of plan they need to put forward. This is the kind that we need to vote it for. It's the only kind that will do what we need it to do. And that means no cost at the point of care. Everybody covered. When we say all, we do mean all. It will have every kind of care that you need covered. Yes, we do have the money for it. I think what they're trying to avoid is moving totally away from the for-profit entities, the insurance companies and the hospital corporations. And sad to say, they can't continue. They just can't. That's what's costing us all the money.
See, you know, I think that's such a great point. And again, we're talking with Jean Ross, co-president of National Nurses United. I think that's such a great point, Jean, because, and confession time here, you know, I have a health financing background. I did work for the insurance industry for a while when I was younger. And I would say that one thing that people don't understand is that the business model of the insurance industry, a lot of nice people work there. I'm not, you know, it's not about the people. The business model of the insurance industry is basically they make money by collecting premiums and not providing care. That's where the money comes from. And because of the way the U.S. has not had a national health care system for 75 years, while so many other countries have, I feel that the insurance companies have become incredibly good at taking the money and not providing the care, and that the only way to make this system work is the way Medicare works, original Medicare, not privatized sections of Medicare, original Medicare, which is by the government taking care of everything, doing it as well as it does with Medicare, and not letting insurance companies cherry pick the ones that they think won't get sick or throwing obstacles in the way of getting care you need or whatever. And I think you guys are onto that.
Well, it's hard to be a nurse, especially a nurse for as long as I have, well over 40 years, that you don't see the difference in how we used to treat people, even with the for-profit system and what we have now. And it would be unheard of when I first started nursing to have patients ask me, what did I think was more important? Which medications could I cut in half? Which directions that the doctor gave me when you're doing discharge teaching can I kind of ignore? Because, you know, I got to have money for the house payment and for rent. You just didn't have conversations like that with patients years ago. And I think it is, as you mentioned, the cherry picking, but it's this also. The hospitals have tried for years to do things what I would call on the cheap and still maintain that their main concern was the care and well-being of the patients. And I'm here to tell you it is not, no matter what they try to rationalize. Nurses know what's best for the well-being of the patient. But when it comes to the system we've got now, the only way hospitals can do it is to deny care. It's the only way. They have used every other means to cut down the cost. Now the only way they can do it is just what the insurance companies do, deny care.
Well, and that's a huge step in the wrong direction. Someday maybe I'll do a segment on it. I had surgery earlier this year myself, and Gina, I've worked in health economics and financing, social insurance for years and years, and everybody kept telling me, well, the insurance company webpage, well, ask the doctor how much this is going to cost. Well, my doctor doesn't know how much it costs.
No.
Ask the hospital. They sent me to the hospital billing office. I knew it wouldn't work, but I did it as an experiment because I'm fighting for Medicare for all. So they sent me to the hospital billing office. The hospital billing office said, ask your doctor. The doctor said, I don't know if they're going to bring in as an assistant surgeon. I mean, there's absolutely no way to know until the bill comes in, and it's, in my case, $3,800 for, that's a lot of money. And
well, it is. And I will tell you, there's a reason none of that works. None of this shopping around business works. For one thing, many people are at their most vulnerable when they're shopping. For the other, even if you're not ill, but you're contemplating something elective, again, you're stressed. But the fact is, healthcare should be, and we believe it is, and most people believe it is, a basic human right. You don't go shopping around. You don't use consumerism. You don't look at competition. It's a basic human right. And basic human rights are what we, according to our Constitution, fund for the welfare of the people. It's what we've done with education and many other things, and it's what we should be doing for health care.
And, not to make this all about me, but just as an example, I was in constant pain, and I was asking all these questions. And the other suggestion that my kindly insurance company had for me on their webpage was, ask the doctor, is there a cheaper alternative? This is what we've come.
I've seen that.
Yeah, and this is there a cheaper alternative, maybe one that involves me staying in continued pain for the rest of my life? And this is the system that people are fighting for when they fight against Medicare for all, which is why I think you guys are doing such a great job there.
Yeah.
And I guess we only have a minute or two left, but is there anything else we should mention on the fight for Medicare for all?
Yeah, I think that you brought up financing, and I will tell you that the cheapest, the most economical way is Medicare for all, a true Medicare for all. You don't spend the money that we do with all these different insurance companies and their different plans. That administration is what's taking all the pennies out of our dollar that other governments do not spend. And that's why we cannot continue with the for-profit system we've got. I want to make sure to tell people how to get involved. And they can visit the campaign website at www.medicareforall.org, and that 4 is the number 4, not FOR. They can sign up for action alerts, but they could also email info@medicareforall.org with any questions that they have.
Okay, perfect. I'm so glad, because I think it's going to take everybody working together to make this happen. So Jean Ross, acute care nurse and co-president of National Nurses United, thanks for all your great work on this issue, and thanks for coming on the program.
You're very welcome.